Hello again, everyone. This is Dr. Dan Bockmann. Today, we're going to talk about why I start post-op rehab with my patients the day after surgery. So I don't care if it's a spine surgery, knee surgery, shoulder, Achilles reconstruction, or yes, it does not matter. I start post-op rehab the day after, and here's why. And you would think, well, you just got cut on, and your sutures haven't healed even close. I mean, you were just in the OR yesterday. However, here's my rationale. First of all, yes, you're very limited after, let's say you have an ACL reconstruction in your knee. You're very limited. You can't walk around. You can walk on crutches. But the problem is, if I had an ACL reconstruction in my knee, even though it's just my knee that's the problem, the rest of me is fine, right? That knee has then taken me out of all the other activity that I can do. So maybe I was a runner or a tennis player, or I like to go hiking, or I like to go swimming. Guess what? I can't do any of those things now. So that one injury has then eliminated all the other exercise the rest of my body needs. Now, there's no reason to decondition your entire body just because of one joint injury or a surgery. So the kinds of things I might give a patient day one, for after a knee surgery, I might give them leg raises. They can raise that leg, right, and lower it down in bed. They've still got their polar care ice sleeve on their knee. They can raise their leg. They can move it side to side. They can slide. They can do heel slides on the bed. So they won't be able to bend their knee much, but they can do little movements. They can stiffen their leg by using their quad. So if this is your knee here, you can stiffen and relax to keep the quad stronger. Because the risk is, if you do nothing and just lay in bed for 6 weeks while till you're able to supposedly be weight bearing again, what's going to happen is all your muscles head to toe are going to get weaker, and all of your joints are going to get stiffer, which means once your knee recovers, everything else needs to recover too. So I like to keep all your moving parts as active as they can be, doing things that are small and safe, so that there's as little of that degeneration and atrophy as possible. And of course, we can kind of add little incremental increases in the intensity of the work we do or the range of motion work we do. Of course, I'm not going to tell you to do this on your own. Always talk to a rehab professional about what the right entry point is. Every surgery is a little different. Sometimes there are timelines and restrictions that a particular thing can't happen until this date, then we can add it in a safe way. So my point being, there's almost never a time, any surgery, spinal, extremity, shoulder, knee, foot, ankle, whatever, where there's nothing you can be doing to improve your recovery. There's almost never a time during a recovery where you have zero tools at your disposal and you just have to lay there like a vegetable in bed. In fact, that's going to delay your recovery. Because let's say we wait until your knee recovers from the surgical repair. Well, guess what? You can't go run now because the rest of your lungs are deconditioned, your cardiovascular system, all your muscles are stiff. So there's always something you can do, and it can start right away. It just needs to be a safe entry point, and then gradually increasing it over the timeline of your recovery. Now that's going to help keep you saner too. Trust me, if you're used to being real active and you're laid up in bed from a surgery, you're going to be going crazy. You've got all this energy and stress you want to blow off, and you have no outlet for it. So talk to your rehab professional about that. There's always something you can do. And if you've had a surgery, I hope that's been helpful. If so, subscribe below. If you have a question you'd like me to answer, leave that in the comments below. I'd love to get back to you with a video answer for that. Until then, I'll see you guys next Inside. Thanks.